So welcome to the college seminar, and I'm Marie Harvey, the Associate Dean for Research, and I'm happy to see all of you here today. Those of you in person, please help yourself to coffee, tea, and treats. And those of you on Zoom, maybe you can see what you have in your kitchen. Anyway, I do want to mention, if you're coming in on Zoom, that it's a webinar format, and that does mean that to ask your questions, you will need to put them in the Q&A, and then we will read them to the panel. So remember, you can't, you have to do that on the webinar. So what I do want to do today is just to get us going and to maybe provide a little context. Let me just go quickly to say who's here, and then they're going to introduce themselves a bit more too. So Dave Dallas, Sunil Khanna, Megan McClelland, and Suzanne Sagerman are our center directors, and they're going to each come up here and talk a bit about their centers and tell you more about themselves, or maybe I don't know what you're going to do. Anyway, let me just quickly say a bit of context, and that is that what we're doing is we are acknowledging the need that we need to solve kind of the wicked problems we're starting to face as we look at health and societal issues. We need diverse perspectives and just diverse expertise to come together to solve these problems. So we need collaboration and we need interdisciplinary work. And so the center directors have joined my team, and we're all going to work together to try to build collaboration to be successful in addressing these issues. It also really is going to align with what's going on with the university strategic plan, Prosperity, widely shared. As you know, it calls out for our capacity for collaborative transdisciplinary discovery, and it prioritizes 4 areas of growth, 2 of which I think are really important to our college. That is integrated health and biotechnology, climate science, and related solutions. So what I will do now is just hand it over to center directors, and they will first tell you a bit about their center. Secondly, they're going to talk about potential collaborations that they've thought of, and then they're going to really invite ideas from the audience. Okay, I think Dave will take it away. And I didn't even turn my slide. Yes. That's huge.
Yeah, so the idea for today was, Marie got us together to try to figure out what the centers can do together so that we can, work synergistically. So we're talking about these synergies across our research centers. And so we're going to be presenting a little bit about each of our centers, and we have some ideas, but then also we're really looking for input from the group here. We're going to be taking lots of notes and kind of a brainstorming session about what we could do as a college together. So if you don't know me, my name is Dave Dallas. I'm an associate professor in nutrition, and I took on the role of director of the Moore Family Center in May. So I'm just getting started. And the focus of the Moore Family Center has been focused on helping individuals and communities live healthier lives through good nutrition. And they've done this via research on how food can promote health and prevent disease via research and outreach projects. And they've been doing some really great work under the 2 previous directors, Emily Ho and Siu San Wang. Their teams have focused on a variety of different projects, including a wide range of community cooking classes and a grant-funded project called Hope Grows Here, which is a mentor-supported gardening, nutrition, education, and wellness study for cancer survivors. And they've also developed a mobile teaching kitchen that teaches cooking skills to people in transitional housing and underserved communities. So my vision is to amplify the Moore Family Center to be renowned for interdisciplinary research at the intersection of food and health, and also determine ways to translate this food and health research that we do here at OSU to enhance health in communities. So in this first year, the focus areas that I have, the first is building interdisciplinary teams. of faculty across biological, social, and implementation sciences to advance food and health research. And secondly, I'm going to work to develop strategies to translate research into practice. And then I'm going to be doing a lot of work to try to figure out how to, oh, yeah. Is that good? Okay. So, yeah, no, it's good. So doing work to help define the specific vision of the center and try to make it very unique within the college, within the university. And then, of course, I'm going to be working a lot to increase the funds that the center has via, working with donors, but also developing grants, training grants, center grants, which is why this is a really great opportunity to work with these other centers. And at the end, we'll talk about more collaborative ideas that we have. So now I'll pass it over to Suzanne to explain a bit about CHAR Center.
Yep. Hi, everybody. Thanks, Marie, for this invitation for us to talk about our center. That worked out well. There we go. It talks about our centers, what we're doing, and how we might work together. So I'm the director of the Center for Healthy Aging Research. The center focuses on all aspects of aging. We have a true bench-to-bedside, cells-to-caregivers research center. So we have people doing cellular or bench animal model work on aging and neurodegeneration. And then we have people working at the level of the person, of groups, of societies. So I am taking over sort of sole leadership of CHAR. I've been sharing leadership with Emily Ho for the past year. She's been showing me the ropes. And so my broad goals for the center are to really expand its role across that domain of bench to bedside, to grow us as a resource hub and point of connection for researchers in adult development and aging across campus, and also to become a source for reliable evidence-based information for community members. We have just finished redesigning our website, and so we are building out a place for community resources in the center's website. So we're hoping to really become the place where people can go to find information and resources. One of the things we've done with CHAR in the last year, we used to have disciplinary cores in the center. And rather than having those silos, we decided that we would dissolve them and reorganize around interest groups, being more topical and also being more flexible. So our first interest group is on neurodegeneration, and that includes Alzheimer's disease and related dementias, ADRD, Parkinson's disease, and amyotrophic lateral sclerosis, ALS, which some people also know as Lou Gehrig's disease. And in this interest group, we maintain the bench to bedside coverage. So we have people like Alicia Reyes Morgan, who is working on group-wide models of neurodegeneration. And on the other side, like I, for example, do things like work on personality influences on the incidence and progression of ADRD and ALS. So I just mentioned we did a website redesign. We'll be adding more resources to that. We're promoting that more in the community as a hub for information. Really want to think about center and training grants in the next year. There are grants specifically to grow the resources that a center offers. Really interested in pursuing that. And we've also talked, as we'll share later, about an inter-center training grant. So some points of connection across centers. We have people doing work on nutrition and malnutrition in adults. For example, Emily Ho does work on micronutrients and cognitive health. But there's also good evidence that older adults are more prone to protein malnutrition. And so connecting to some of the other centers on that dimension would be possible. Neurodegeneration and cognitive decline are a really important topic in the center, and it's the focus of our first interest group. That phenomenon is not, as I tell my students in adult development, it's not like you're going along and you're just fine, and then you get old and stuff happens, and then you start to have neurodegeneration and cognitive decline. In fact, the proteins associated with Alzheimer's disease start accumulating in the brain early in adult life. So almost everybody has some level, for example, of beta amyloid in their brain. And so thinking about this full lifespan from childhood all the way through older adulthood is relevant for neurodegeneration and relevant for cognitive decline because these processes are occurring across the lifespan. And finally, we'll talk a little bit about sexual and reproductive health. Obviously, as we think about adult development, menopause is a big topic in aging, and the health risks that come along with it, and also some of the psychological health effects. So that's a quick overview of CHAR and some points of connection. And so I will turn it over to Sunil.
I will be quickly. How's that? Can you see me now? Thank you. Can you all hear me okay? Yeah. Okay, so my name is Sunil, and once again, thank you, Marie, for organizing this session. I found our initial conversations to prepare for this were very insightful and very educational. So started thinking about lots of new ideas, which is kind of a good thing. So I'm Sunil, and I'm a professor in public health in the School of Nutrition and Public Health. I'm delighted to be here. Started my position in mid-January, so still trying to figure out the history of the center and the direction in which the center could go. I imagine the center to be a hub for multidisciplinary collaboration. The field of global health lends itself very easily to multidisciplinary collaboration. So the center could be kind of a shining star in that direction. And the mission is to promote research, facilitate engagement and learning, and build partnerships in this broad field of global health. Now, the center's work also extends beyond the college and the university by building alliances with international partners, private agencies, government organizations, you name it. The center has worked and will continue to work with all those diverse stakeholders. So under the leadership of Dr. Chi, who was our previous center director, we have forged strong partnerships and laid a good foundation for the center's future. One thing that I wanted to brag about was that our center is very uniquely positioned west of the Rockies. We don't have another center for global health that is working with people, that is working in the area of translational research, in the area of intervention research. We do have a center up north with the University of Washington, but most of that, the work of that center is focused on epidemiological data synthesis, data collection, and data analysis. So our center is very uniquely placed, both in terms of its thematic areas and also geographically. So looking ahead, the vision for the center is to strengthen and diversify our role in promoting research, education, and an important component of the land-grant mission of the university is community engagement. And this will involve strategic initiatives and collaborative efforts with faculty, of course, college leaders, and our partners. So regarding research, the center will work with faculty across the college and the university, and also with international partners to identify global health challenges that match our expertise and seek extramural funding to build a center of excellence in global health research in our college. My goal is to do that, to build a center of excellence in global health research here. So I wake up every day thinking about these issues. The center will also strengthen its activities to promote opportunities for education and training in global health research, global awareness, and global learning. I think those are critical pieces that the center could move forward, because research and learning and opportunities for students, they just go hand in hand. They are, in my way of thinking, they are quite connected. And this will help us prepare future global health leaders. For the first year, I am seeking broad input from faculty in the college to identify thematic focus areas and establish interdisciplinary research groups. You all have received an email from me. I'm sorry, but this is the time of the year when you get like 500 emails a day. So please respond to that email. That is a 5-question survey that I am seeking your advice, your input, to develop some areas of focus, and also how the center can best serve you. I'm also seeking resources, identifying opportunities for global health research and learning, specifically targeting research center grants and training grants, and also looking at development opportunities, fundraising opportunities to support the activities of the center. In initial conversations with me, faculty in the college have expressed a strong willingness to strengthen our research in the area of planetary health, sexual and reproductive health. You already heard about it, and you're going to hear a little bit more about this thematic area, and also in the area of global nutrition. And at this point, I'll hand it over to Megan.
Hello. Thank you for coming today, the day before a long weekend. I'm sort of surprised that people showed up, actually, but it's really awesome and just shows how incredibly interested you are. So I'm happy that we can talk about some of the really exciting work that people that we have the privilege to work with are doing in the centers that we direct. My name's Megan McClelland. I'm the director of the Hallie Ford Center for Healthy Children and Families. We're really fortunate enough to be in this building that was really started by the work of Tammy Bray when she was dean, and then also Rick Setterson when he was the first director. I took over a few years ago, and in that time, a number of things happened, and we really showed some pretty transformational growth that I'll talk about. I'm going to first just talk a little bit about some of our vision. We're a little bit more of a mature center, and we have a building which helps. But what we do is we really promote the development and well-being of children, youth, and families by generating, translating, and sharing research-based knowledge. And so we have at this point 4 different research core areas. And I'll quickly give some examples. What I would say is there's just been incredible amounts of development and diversity of funding sources that have occurred in the last 5 years. With work that is primarily housed and done in the center and across the state and beyond. In the area of early childhood, we have Megan McDonald has been the core director for that. She's now school head, so she and I kind of manage that right now. A few examples, we have a NIH, one of 6 in the country NIH center grants called Aspire that Molly Kyle leads with myself and a really stellar transdisciplinary team of Mary Heistad, Veronica Irvin, Allison Myers, Megan McDonald. These are like the great people you want to work with because they're fantastic. So it's really looking at climate and children's environmental health. So very translational, great work happening there. We have a statewide center grant that's quite large that reaches across the state of Oregon. And I've hired 30 people in the last few years. On that big center grant. It's called the Early Learning System Initiative. And it started with a $14.5 million grant, and it's about 7 million every couple of years. And then we also have an additional grant that's related to that on inclusive practices for young kids with disabilities. So lots of links with this really gets at sort of building up a system-wide a set of supports for educators in early childhood. And also there's lots of ways that we can elevate and provide career-ready options for students that go to school here. So lots of connections there with translational research. Then we also have work we do on school readiness and early learning. So we have a couple of federal grants there. We have a donor-funded gift called Bunny to Bunny that was related to a book that I was able to work on with collaborators in some other places. And we've got a gift for a couple $100,000, and that book has gone out to about 75,000 families in Oregon and across the United States, which is pretty cool. It's an evidence-based our caregiver-child interaction book. Youth and Young Adults Core is led by Jonathan Garcia in Global Health. He just does incredible work on youth voice and engagement. And so I'm really excited. He brings such wonderful things. We just hosted a conference on youth community engagement here at OSU. It's called the Joy Conference. He helped coordinate that. We gave a little help with that. We look also at positive youth development. Kathy Gunter, a superstar Kathy Gunter, it leads our healthy eating and active living research core, and lots going on there in terms of physical activity and nutrition. There's programs called Being Physically Active Today, or BEPA, that is widely used actually around the United States, as well as some other physical activity programming. There's more. I don't want to forget. Parenting and Family Life, led by Shauna Tomini, another great, incredible superstar we get to work with, has a statewide parenting education, lots of statewide centers and initiatives. I mean, I think this really demonstrates the impact of Oregon State serving the people and the mission, the people of the state. So we also have a statewide parenting education collaborative that's led by Shauna and her team that has experienced a lot of growth in the last 4 or 5 years. So that's housed in the Hallie Ford Center. And also when we've hired all these people, the important thing is they're really embedded in the communities in which they're living and working, because that's the goal of like this kind of community engagement and research, and taking the work that we do at OSU and making sure we're getting out there, but then they're also driving the work that we're doing and telling us what we need to do differently and better. We have other things. Policy is also a big arm. Family Impact Seminar that had been here for a while is now led by David Rothwell. He just got some funding from Penn State to continue that work. So that's been a really exciting initiative. And then I forgot to mention, Kathy Gunter is also involved with someone in economics, Paul Thompson, who does great work on the impact of policies like the effects of a 4-day school week on children's academic outcomes in rural areas. Super interesting work. And they just they hosted, let me not overstate that, they hosted a conference on 4-day school week last fall, which was really exciting. That was funded from the Spencer. There's more, but I'll stop there. So I think it's really exciting time for our center. Lots of diversity of funding from federal, state, donor, and other sources. So I'm excited to keep that moving. Oh, I didn't even say, this is where we're going. We're going to continue this growth. We're going to expand the infrastructure. We have a huge amount of work that we're doing that we need to really just build out and continue to build out. I'm very privileged to work with an incredible team. We have an incredible alignment, I think, with the strategic plan and integrated health, and also in climate in these areas of early childhood, youth, and child health, well-being, climate, environmental health, the children's environmental health work, parenting and family. And so we're all about collaboration here. We do lots of transdisciplinary, interdisciplinary collaboration and teams. That's one of the things I do really well and I love doing, is building out different teams. So these are some of the areas, and we're also super good at translational research and community engagement. And with that, I'll stop. I think Suzanne's taking over next.
So we want to we want to sort of set the stage for discussion about synergy among centers by situating ourselves and identifying some of the cross-cutting topics and themes across the centers. But first, the boxes in this image represent the context in which all the centers are situated. So all of the centers are addressing integrated health. And for me, integrated health means physical, social, psychological, cognitive health, the whole person integrated. And that means interdisciplinary work. One person cannot do all of those things at once. And so the integrated health sciences for the centers means interdisciplinary research. Obviously, all of health research is situated in planetary health. Climate change is real. It's having substantial impacts. As far as aging is concerned, older adults are much more likely to die of heat-related illness than people in midlife. And so in the absence of air conditioning, and of course, we know there are huge disparities in access to air conditioning. In that absence, older adults are at great risk. Obviously, parts of the globe are more prone to heat and weather exposures, and so the global south, obviously, this is a big challenge for them. And in terms of food availability and preservation, obviously, heat is a big issue in terms of what crops are grown, what's available to people, and how they keep their food safe. Within that, you've heard some about the translational research, biotechnology, and community engagement being done by all the centers. And among the centers, now we can talk about some of our topical things related to the social and behavioral determinants of health. So we've mentioned sexual and reproductive health. That really connects to lifespan issues. It connects to things that are happening in adolescence. It happens to things that are happening in midlife, like menopause. It also applies to older adulthood. So you may have seen stories about outbreaks of sexually transmitted disease in living communities for older adults. So, it's not something that you age out of, sexual and reproductive health. Nutrition, micronutrients, and gut health, lifespan, and neurodegeneration are all connected to each other. We know that cognitive health is sensitive to micronutrients, obviously, to protein malnutrition, but also to the microbiome and to changes in the microbiome. One of my students just finished a project looking at cognitive problems and changes when older adults were taking antibiotics, which of course interfere with their microbiome, and found in fact that older adults had more problems with inhibition in everyday life during times when they were on antibiotics compared to when they were off antibiotics. And so that's an example of a connection among aging, the microbiome, cognitive health. And so what we want to do is expand a little bit on some of these synergies across centers, but also to solicit your ideas and your thoughts about where we should be looking at other points of connection. So there's a little bubble that says your idea here, and we'd like to fill that in. So I think I turn it over now to Dave.
Okay, so I was just thinking about gut health as a potential theme. And so I just kind of jotted down some ideas here about how various people in the different centers and in the faculty more broadly might contribute to a theme like that. So I thought about Moore Family Center as contributing expertise in terms of nutrient digestion, the release of bioactives in the gut. We actually recently have this, thanks to the college, support a new instrument that is a large-scale simulator of the human digestive system that can be used for examining lots of different kinds of foods and different ages of people or animals, and examining how foods affect their microbiome as well. So that could be a really great resource that we want to bring people to. Looking at the effects of nutrients on the microbiome in general, even looking at how the results of digestion affect kinds of cells related to the gut, intestinal and epithelial cells, immune cells, bacteria. And then with CHAR, I was thinking about looking at the effect of aging on gut health. There's some suggestions that people decrease enzyme production in their gut with aging, and so that could be something to explore. Digestive function and the effects of gut health changes on neurodegeneration or cognition. And then, like Suzanne was mentioning, the effect of like sarcopenia, how gut health could contribute to or increase risk for sarcopenia. And then with the Hallie Ford Center, I thought about, how does gut health affect child development? Can we improve that? How does it affect different developmental conditions? Thinking about the Aspire grants, how do different environmental exposures affect gut health? And then with the Center for Global Health, thinking about how malnutrition or infections that might be happening in developing countries, how that they are affecting gut health, and how those long-term effects could affect their overall health outcomes. And then thinking about LPI, again, looking at how micronutrients might affect gut health. And there's a bunch of different folks there that might want to contribute to that. And then beyond our centers, we could look at the microbiology department and look at, various aspects of the gut microbiome and food, and then expanding to other universities like Oregon Health and Sciences University, collaborating with different units there, like the Digestive Health Center or the Neonatal Care Unit, which I already collaborate with. People that are doing research on gut epithelium, that could be a great tie-in. And also the Food Science Department would be a really strong collaborator here. There's people like Joy Waite-Cusick, who works on food pathogens and how they affect gut health. So that was one idea that I had to tie things together. Okay. All right. So we've got sexual and reproductive health. Who's something about that?
Okay. So these are our ideas, that our initial ideas, actually, that we're thinking where the centers could collaborate, could work together. What we would really appreciate is hearing back from you how these ideas can be further developed or better aligned with the college's strategic priorities and also the university's strategic priorities, the strategic plan of prosperity widely shared. We were thinking primarily in terms of identifying just a few topics to initiate these conversations. We do have quite a bit of expertise in our college and also the university on these thematic areas that we have identified, but we are by no means limited to those. So really appreciate your thoughts later on in the conversation. Sexual and reproductive health across the lifespan. Suzanne set the stage very nicely. We never really get out of the SMH throughout our lifespan. We are dealing with SRH issues. For several reasons, both nationally and also globally, sexual and reproductive health research as a broad thematic area is experiencing a rejuvenation. Researchers are increasingly getting more and more interested in this topic. Nationally, the conversation has taken on a more of a political bent to it, especially after the Dobbs decision. We've had several colleagues talking about this issue, and we have great interest among students wanting to know what is happening in the field of public health, what about sexual and reproductive health issues, access to healthcare, reproductive healthcare, and those issues. So we see this as a very timely topic where researchers, students, and the funding agencies are taking that line in terms of supporting research in this direction. We definitely see all the centers performing very specific but very important roles in this area. Moore Family Center could talk about nutritional factors related to SRH issues, especially related to infertility. Center for Healthy Aging. I don't need to kind of belabor the point, but menopause, sexuality, intimacy in older adults. These are some of the thematic areas that come to my mind, by the way. Hallie Ford is positioned very nicely to contribute to this area. There are researchers in Hallie Ford, Jonathan Garcia, and others are actually working on this particular thematic area. And then the Center for Global Health is looking broadly at reproductive health and maternal and child health services. An emerging topic of interest to the National Institutes of Health, especially the National Institute of Aging, is what's happening to people who have been living with HIV. So, as you know, in almost every part of the world, access to ARVs is now it's easy and it's available. So, what's happening to people who have been living long term on ARVs, and what's happening to their health? Beyond the center's reproductive health area, we have a reproductive health lab in the College of Liberal Arts, the School of Public Health, and the University Center for Excellence in Development Disabilities at OHSU, PSU. I know a couple of researchers who have expressed interest in working in this area. And so this is just like another thematic area that we're thinking about, and look forward to getting your thoughts on it. Okay. We will turn it over to you. Thank you.
Online. This is from my limitation of students to conduct this. I advise 12 MPH students who are wonderful. However, MPH students, for the most part, do not conduct original research. Most completely. Does it make sense to develop a COH MS degree so there will be more students conducting research? Good luck. That's good.
I don't know if I can answer that question in terms of the MS degree. That's outside of my area. But I have been advising and working with MPH students on their internship experience. I developed programs in India and in Botswana, and I found that MPH students get really excited about their internship experience. And while that particular experience may not lead to original research, I found that many MPH students, after that internship experience, get very excited about careers in public health and a PhD degree in public health, which eventually leads to original research. So MPH internship can feed and can contribute to development of new research ideas. And several of our MPH students end up in our PhD program because they find that internship experience to be exciting and fulfilling. So I don't know if I answered that question, but there is some dimension to the MPH internship.
Well, I'm not a public health person, but I'm very pragmatic in how we use, and we've been able in the Hallie Ford Center to use MPH students in a variety of really creative ways, not just within, but like I had an MPH student of mine who also who got a PhD in HDFS. It was one of my students, and he went and worked at the state and analyzed statewide data for children's entry to kindergarten because he was in biostatistics. And, it did end up contributing quite a bit, even though he was also a PhD student. But there's lots of different ways I think that we've been able to have interns contribute to things that then lead to research. But I understand the challenge, and so I don't want to speak for my public health colleagues because I really understand the issues.
Yeah, but go ahead. I was trying to kind of look for more idea generation.
Here's an idea.
Yeah,
Right. Behavior tends to have a major impact on health, and culture has a major impact on behavior. For example, Suzanne mentioned that climate change is real. There are some universities in this country where if she'd said that, she'd be looking for a new job. And the issue of reproductive health is very heavily culturally influenced. So I'm wondering why you don't have sociologists, anthropologists, culture experts involved in this, because if you really want to make a dent in public health issues, they're important.
I believe we have faculty in the Center for Aging Research in those areas. And so we're housed in health, but we have faculty from all over. We don't have just colleges.
And we will, point very well taken, and we plan to reach out to other faculty in other disciplines. And just FYI, I'm an anthropologist by training, so
Okay, so I have a lot of ideas that I'm trying to pull together in my head, but I'm going to start with one. So I do research in cancer survivorship and also sexual reproductive health, but just on the cancer front, and I know a lot of other faculty that I work with around cancer prevention, early detection, screening, and survivorship. I mean, we do the work, but we have trouble finding a home in the centers. So I can see a lot of crossover in a lot of the centers, but I don't know, if that's another idea that can be developed or where that interest area and that research focus can live in the way that you're talking about this kind of integrated ideas. If there's opportunity to kind of think through that, I would be interested in talking more about it, but I just wanted to throw that out there. That's idea one. My other thought is I'm happy to see sexual and reproductive health out there and you all talking about it. With Marie and Jonathan and we had been, trying to get some sort of consortium around sexual and reproductive health that we're still trying to get rolling that hasn't really found a home either. And so that crosses over into everything that I think that you were just speaking about, Sunil. So I just wanted to throw that out there as well as another kind of resource, and that we're kind of in discussions trying to figure out where that will go as well. So those are my things. Happy to talk more later too.
Yeah, thanks. Thank you. Would love to talk more about this.
So I want to throw out a perhaps idea that would cross all of your centers, and that's work life and balance. I mean, that's a lot of people work and kids work and life happens and stuff. And so there's some expertise in the college and HDFS and wide area that I think it would be interesting if there's some synergies around there and support around there. If you're looking for ideas that connect. And then the other thing I think would be really good, I've heard from graduate students that a lot of talk, like you're even presenting today, is that research can be very impactful if it's interdisciplinary and connected and collaborative. And I think some of the graduate students hear that and crave engaging in that, have a hard time potentially within their rigor of their program and needing to get their dissertation topic narrow so that they can finish their dissertation. And I know I've been asked if there's potential kind of conversations or resources or ideas on how they can grow that as their year and then carry it forward as they launch their careers. So I don't know what that looks like, but it seems like that would be an inter-center way to talk about that. And I know I've talked with you, Dave, because you were on this big interdisciplinary thing. So I know there's things going on at the university like that. But I would just, and not only graduate students, but perhaps even faculty and might be interested in some kind of forum around that. So I don't know if you're also planning to do service things for the college, but maybe that would be something that.
Thanks.
Of course, I immediately start just like going all different directions. Laurel, you're awesome. Well, it kind of, don't you think it fits with the training grant that we were talking about? And so you need a mechanism, right? I mean, the way that our transdisciplinary teams have worked when we don't have, obviously if you can seed them some way, right? I mean, we had, the example we always give is we got funding from Hallie Ford when Rick was director, and also from the Environmental Health Center. We got like $25,000 or something to start our first flame retardant study, and with Molly Kyle, and then I brought people together, and it was very little money, but it was like people low walls, and somebody was interested in leading something, and then we got each person to get some data that was important to them, and then they first authored a publication. And so I brought faculty together. That led to an R01 from NIH, and that led to our NIH Center grant. And so obviously this didn't happen overnight. Obviously, I mean, it's been like 10 years when, in the beginning, I didn't know what a flame retardant was and whether I should care about it, to be honest. And now I'm like, flame retardants, they're everywhere. So I think the way that we just figure out how to create opportunities for people where they have a vested stake and they can get information and data that's useful to them, that they can then use to publish on, that counts for the journal for them. All those things. I mean, we've been really able to do that. And so, and the other thing I'll just say about grad students, if we can get like the training grants, great idea. And I know that Char's had success with that when Karen Hooker was in charge a while ago. And so, when we have students sitting next to each other, I had a grad student who worked with got to be friends with another grad student, and all of a sudden they start collaborating together, totally different areas. Did a study, wrote up a paper. It was the most downloaded paper that year in the journal because it was like totally different. I would never gone that direction. So, I think there's lots and lots of opportunities, and I think we just have to be creative about, and we need to provide incentive for faculty who are overburdened, have no time, for it to be worth it to them to engage. You can't just say, oh, this sounds like a great idea. Go for it. Well, at 11 o'clock at night, right? So, which is when we often are doing this work. Yeah, sorry, to make that take over.
Yeah, so as Megan mentioned, Char used to have a training grant through NSF. They discontinued the mechanism, and so that's why they lost that training grant. But I think what we are interested in doing is expanding a grant like NIH T32, if you're familiar with that mechanism, is for predoctoral and postdoctoral training. We have the opportunity to take one of these themes. For example, we talked about neurodegeneration being low-hanging fruit, and create a training experience that is interdisciplinary at its core, that involves doing rotations through the different centers, doing different kinds of research. And so people seeing what kind of research is going on in other disciplines leads to these interdisciplinary ideas. And it's possible to do an interdisciplinary dissertation, for sure. I did one working with an immunologist. So I know it's possible. It's harder to do. It's harder to put together. But if you've been in a training grant where you've gotten exposure to other faculty and other disciplines and other things that you're interested, then you're already sort of a known quantity across the centers or across the disciplines. And it's easier to put together a research project that is at its core interdisciplinary.
Or it includes both things. We had a graduate student of mine who got a diversity supplement grant from NIH for the flame retardant R01 And then part of her dissertation was on the environmental health side, and part of it was more on the HDFS side. So it was actually a really nice combination. Sorry. You guys want to say something? I didn't mean to take over.
Yeah, I thought that it could potentially be helpful. I think the extension school does some more about rural economic development, and they've had previous work that they completed with farmers throughout and looking at food systems in different areas of Oregon. I think that relates to a handful of what we talked about.
And that last bit of extension books. Yeah. And great.
In fact, in our statewide center grant, I'll just say that we got, thank goodness I talked to somebody and they suggested I could rent out space in extension offices for some of our new hires that I had for the statewide center grant. So that's what we do every month is we rent out some space. So it's a great example of how we can take some of the folks here and then, integrate them more with county extension offices. Yeah.
Speaking of opportunities, there are a lot of retired faculty in Corvallis. There are a lot of retired professionals, and probably more important than that, there are a lot of retired non-academics who are looking for useful things to do. And is there any opportunity for them to get involved in this kind of stuff?
Yeah, so the center has something called the Life Registry. We have something called the Life Registry. If you go to the CHAR website, we've redesigned so you can go straight to the registry and volunteer, sign up. It's currently kind of a registry. It's more of a list of people who are interested in participating in research, who are willing to be contacted about research studies. One of the things that I would like to do, if we can get some resource support, is to make it a true health registry. And so, every year we would be asking people about how they're doing, what their health is, are they feeling stressed, all of those kinds of things, so that people are really contributing to a large database, where we can really look at older adult development. We are in sort of initial thoughts about combining with an OHSU registry, which is very large and does that already. So, we have a lot of room to grow in terms of involving people from the community in the registry, and then also beyond that in terms of participatory research and those kinds of things. So we have at Shore so much room to grow. We need time and money and volunteers.
This is the point I was trying to make. To involve these people not as subjects, but as actual investigators.
Mm-hmm.
Because there are a lot of people with a lot of competence out there.
Yeah. Yeah. Behind you, you had a question or a thought?
Yeah, just so weird conversations to go through here. I'm just thinking about the integration with Samaritan through a lot of these. We have some representation in the room from Samaritan, and we've talked about this over the last few months. And just access to patients, resources, providers. It's a two-way street in that Samaritan is also looking for ways to engage more research. So there's a lot of opportunities there. And as much as I love going to Portland, we've got some amazing resources 10 minutes down the road.
I mean, what Suzanne was just saying, immediately I'm thinking, well, we have access to that population that you want for the registry. And that could be even as simple as recruiting through Samaritan to get access to the population around. And so, yeah, we want to contact.
How many people participate in registry right now? There's, I believe, 200 something. 200, 250 and 350. They all work at the one was 800. Yeah, the numbers, obviously, here's the thing about working with older adults. They become ill, frail, or they die. And so, growing so fast. You have to continually be bringing people in to a project. And so doing things like refreshing a registry or doing additional recruitment for a registry is really important. But, obviously, we all know that any kind of endeavor like that takes time and resources. So job one is to find that time and those resources. And I have you to here, you have over 2,000.
Yes. Great.
Well, I see we only have 1 minute. Tammy wanted to jump in too. Tammy, do you want to say something?
Go ahead.
Well, I was just going to say I'm grateful to each of you for your leadership. And it feels like a really exciting moment in the sense that 3 of you are more or less brand new to your positions. So it's a kind of fresh opportunity to take stock in your own interdisciplinary centers, right? It's not that the centers are themselves disciplinary. They're already interdisciplinary. And I love the fact that you're thinking about connections across the centers, because my mind has also been flowing in that direction these days. But I think you all have really important work to do right now as you each roll up your sleeves and think about what the hallmark or signature areas of your own center should be. Like, where's the deepest expertise? Where are the most promising opportunities? And so I don't want you to lose sight of that, of course, especially as the 3 newbies here are really thinking kind of, in brand new ways about the architecture of your centers and about the composition and emphases of the center. So don't lose sight of that, of course, but I do love the fact that you're thinking across. And the 2 areas you put forward today are great starting points where there are some natural connections. So anyway, I guess it's an exciting moment. So that's also heightened by the fact that we're working on a new strategic plan for the college. And somebody already referenced prosperity widely shared and integrated health and climate science. We want to keep our eyes on those things too, right? Because the university has goals in those areas. So there are going to be hard choices ahead too, right? So possibilities may often seem endless, especially once you start crossing centers. But where are we really going to put our emphasis down? And so I guess I wanted to close by just asking you, what are you most excited about as you look forward to the next era, whether it's about your centers or whether it's about how you can work together? And
I don't really know yet. I'm mostly excited about trying to figure out what would be, like you were saying, like the strongest area for our center, making it more focused, more specific, and more research intensive. So that's what I'm excited about figuring out. Yeah.
So I'm in a very similar situation. I have sent a survey out. I'm hoping that will help a little bit, and also several conversations. So I'll be able to better answer this question maybe in about 3 to 6 months' time when I have a better sense. But I think your point is very well taken. The center itself, or the centers, are multidisciplinary entities. But what's the structure? What's the focus of the center could be as we go forward? Definitely.
You all have to answer as if you have thoughts. It'd be nice to you.
Yeah, I am really excited by the coalescing in CHAR around neurodegeneration and Alzheimer's disease. It's one of the most feared conditions for older adults, and it's obviously, as the population ages, the incidence is not going to go down. But I'm very excited, not just by that topic, but by neurodegeneration as a focus for integrated health. So thinking about early life experiences, thinking about nutritional status, thinking about heat exposure. There are some neurodegenerative conditions like multiple sclerosis that are more prevalent in warm regions, and they're less prevalent in cool regions, and they also involve dysregulation of heat tolerance. And so I actually know people with MS who moved from Kentucky farther north because they wouldn't have to worry as much about heat exposure. So there's there's all of these kind of interdisciplinary perspectives on this problem that are not just the neuropsychology of dementia and older age. It's how your life history puts you at more or less risk, and how your social and physical environment put you at more and less risk, how your early life exposures, like flame retardant, put you at more or less risk. It's a lifelong developmental process. And so I'm pretty excited about that possibility as a focus in CHAR, but also reaching across the centers and involving all of the centers in that topic, and really taking this integrated health perspective on this problem.
I know his time is up, and I'm just so excited because of how we build the floor center. You listen well with the idea on well-being, multi. I totally agree with you. In fact, that's my question. I was going to say each center will build on its own strength. So don't forget that. You also have the donor behind each center to want that strength to happen. For example, David, you want gut health, which is very important, but don't forget it was based on the whole grain. And that was the whole thing is based on the whole grain. And someone, if you want more, it's still, that was the uniqueness that came about. So each one of you have a unique spot for that. And also the collaboration does not mean, or the area does not mean that you have to have all four area. On Wednesday, we just had one really easy one to see. Snell and I happen to be the office close. We have a student which did nutrition and global health, did malnutrition in children in India. And that was pretty, and in the community started with from using the social ecological model and start from small into community. So that's not too expensive, but you can start with that. And I really watching Megan, you just make my heart. You really took over the center, make it really happen in the future. What's supposed to be happened really make me very happy to say the least. So thank you for all you do, and this is really great. And just one more for the precision health, precision nutrition is all over the world right now. Think about something with the grain. So we want to be ahead of the way what we can do. Not.
So I was going to say, I think I'm to stop, but I think you guys stay around the people.
Sure, yeah.
So why don't we officially adjourn?